Facility-based hospice care, providing compassionate care in a facility setting. Facility-based hospice care is defined as hospice care provided in a facility, such as a nursing home or assisted living facility. The goal of facility-based hospice care is to provide compassionate and comprehensive care to patients with terminal illness residing in a care facility. There are different facility roles and positions for individuals that you will be interacting with. The executive director or operations manager is the individual in charge of managing the operations for the facility. The administrator is the individual responsible for maintaining compliance and overseeing operations and services for the facility. The DON, or Director of Nursing, is responsible for overseeing the clinical team and care plans. The Director of Staff Development is responsible for providing training and in-services to the staff of the facility. The charge nurse is responsible for the team and the care of the patients in their charge. The med tech is responsible for administrating and managing the medications. The marketing director, or admissions coordinator, coordinates admissions to the facility and provides community outreach. The director of social services provides resources and social services to the patients of the facility. The discharge planner plans the patient discharges and coordinates with outside agencies to ensure a safe discharge and transition back to home or the community. The registered dietitian plans meals and oversees the patient's dietary requirements. There are several benefits to providing facility-based hospice care. Coordination with facility staff for comprehensive care planning may improve patient outcomes and experiences. There is an increased level of support for families and caregivers who have access to the benefits of having both teams' involvement. Patients are able to access the social and recreational resources of the facility. The different types of facilities include nursing homes, assisted living facilities, intermediate care facilities, and residential care facilities or boarding care homes. Skilled nursing facilities provide a high level of medical care and rehabilitation services to individuals who require 24-hour monitoring and treatment. Skilled nursing facilities offer wound care, medication management, physical, occupational, and speech therapy, IV therapy, and injection administration, monitoring of vital signs and medical conditions, and assistance with daily living activities. Skilled nursing facilities serve individuals who require post-acute care after hospitalization, need rehabilitation after surgery, have complex medical conditions, or require transitional care before returning home. Skilled nursing facilities are typically staffed by registered nurses, licensed practical nurses, and certified nursing assistants who work under the supervision of physicians to provide high-quality care. Assisted living facilities provide a supportive environment for individuals who need help with daily living activities but still want to maintain their independence. These facilities offer assistance with bathing, dressing, and grooming, medication management, meals and snacks, housekeeping and laundry, social activities, community engagement, and transportation to appointments. Intermediate care facilities provide a level of care that is more intensive than skilled nursing facilities, but less intensive than hospitals. They offer 24-hour care and support for individuals who require a higher level of medical attention, therapy, and rehabilitation. Intermediate care facilities serve individuals who require post-acute care after hospitalization, need rehabilitation after surgery or injury, have complex medical conditions, or require transitional care before returning home. Residential care facilities are often smaller and more home-like than assisted living facilities, with a focus on providing a family-like atmosphere and personalized care. They are ideal for individuals who need support with their daily tasks, but want to maintain their independence and privacy. It is important for the hospice team to collaborate with the facility staff to better coordinate care, improve patient outcomes, enhance the patient and family experience, and to provide additional resources for our patients. Here are some communication strategies that we recommend. Tour the facility. Showing an interest of the facility and the services they offer will help to improve your relationships. Identify the point of contact and establish a method of communicating. By ensuring the team has the correct contact information for the right person, we can avoid miscommunications. Inquire about any rules, documentation requirements, areas off limits, or other policies the facility may have for outside agencies. Hold a care conference meeting with both teams when you have a patient in their facility. Share care plans, medication lists, and the contact information of our team members. Provide education for their facility staff on topics of interest to them. When providing in-services, choose a topic that would be helpful for the facility. Choose a time that favors the facility. Choose an appropriately qualified team member to facilitate. Collaborate with the Director of Staff Development and/or administrator on specific in-services their team could benefit from. Record attendance. Provide a list of attendees to the facility administrator for their records. By providing in-services, hospice agencies can empower facility staff, enhance patient care, and build strong partnerships, ultimately leading to better outcomes and a more supportive environment for those nearing end of life. Maintaining the patient records is extremely important for the facility staff. They will reference the hospice patient binder frequently. It is important to keep the binder in an agreed-upon location. Always check in and out with an identified facility representative when you are visiting a patient. Add the plan of care and visit notes to the patient binder before leaving the visit. Include a note that remains physically at the facility after each visit. Make sure to include the mortuary information so that the facility staff can find it easily. Include contact information and identify the hospice care team so that they are aware of who will be visiting their facility and seeing their residents or patients. Sometimes, challenges come up when working with facilities. These are some examples of the challenges we have seen. Trouble managing facility policies and procedures. Coordinating care with multiple providers. Addressing patient and family concerns. Facility recruiting our staff. Confusion for staff members of both teams. Unrealistic expectations about schedule, equipment, and supplies. And conflicts between team members. To avoid having challenges when working with facilities, establish clear communication channels. Develop collaborative working relationships with the facility staff members. Provide education and support for patients and families. Develop a supportive relationship and attend facility events when able. And proactively identify and indicate facility policies and preferences. Providing compassionate care in a facility setting requires collaboration, communication, and a patient-centered approach. When providing care in a facility, it's essential to remember that we not only represent ourselves, but also our hospice company. Our actions, attitudes, and interactions with patients, families, and facility staff reflect on our organization as a whole. By delivering exceptional care, being respectful and compassionate, and communicating effectively, we demonstrate our company's commitment to excellence and reinforce the trust that facilities and families place in us. Co-creating an elevated end-of-life experience for our patients and those who love them is always the goal.